Schizophrenia. What is it? We often hear about it. It's portrayed in media, such as films and TV shows. But do we have an accurate picture of schizophrenia? Schizophrenia is a mental disorder with a number of different characteristics, including disturbances in thought, emotion, and behavior, along with disorderly thinking, faulty perception and attention, and lack of emotional expressiveness. We will discuss these symptoms in greater depth during the latter portion of this video. It is likely that if asked to imagine what schizophrenia looks like, a person will only envision one aspect of the disorder. Disorderly conduct involving violent behavior, delusions such as talking to oneself, disorientation with the patient confusing who she, he, or they is talking to and where he, she, or they is, all fall into that category. However, the clinical definition of schizophrenia divides it into three distinct domains: positive, negative, and disorganized. Let's take a closer look at all three. We will start with positive symptoms. Positive symptoms is an umbrella term used to identify the symptoms I mentioned earlier. They include excesses and distortions, such as hallucinations, or dramatic distortions of perception, and delusions, or beliefs contrary to reality, held in spite of existing evidence to the contrary. It is important to note that acute episodes of schizophrenia are typically characterized by positive symptoms. Negative symptoms include a variety of behavioral deficits, such as apathy, asociality, anhedonia, a lessening of the ability to experience pleasure, blunted affect, deficiency in the ability to express emotions, and alogia, reduction in the production of speech. These symptoms tend to outlast an acute episode of schizophrenia and have severe negative impact on a patient's life. Disorganized symptoms involve problems with organizing speech and conveying ideas in a way a listener can understand, as well as behaving in inexplicable ways. Movement symptoms are lesser understood symptoms, but they are often also present in individuals with schizophrenia, and they are included in the DSM. They refer to disturbances in behavior, including catatonia, characterized by repeated and peculiar gestures, finger and arm movement sequences, and greater physical excitability. And on the other end of the spectrum, some individuals suffer from catatonic immobility, during which people adopt unusual postures and maintain them for long periods of time.
The causes of schizophrenia, like all mental disorders, are not completely understood at this time. However, several factors contribute to the development of schizophrenia. Genetic factors played an important role. A child whose parent has schizophrenia has about 10% chance of developing schizophrenia. An identical twin of a person with schizophrenia has a highest risk for 40 to 65% chance of developing the illness. However, interactions between genes and the environment are necessary for the disorder to develop. Environmental factors such as exposure to viruses or malnutrition before birth, problems during birth may increase the risk for schizophrenia. Psychological factors are also important since people with schizophrenia are particularly vulnerable to daily stress. Increasing life stressors may predict the deterioration of the illness. Here is a bidirectional relationship between critical comments from family members and people's development of the illness. Critical comments by family members elicit more unusual thoughts by patients with schizophrenia. And unusual thoughts expressed by these patients leads to increased critical comments. At this point, we only talked about genetic and environmental factors, that there are other causes for schizophrenia, such as the irregular neurotransmitters in the brain and an impaired brain structure.
Before the 1950s, people with schizophrenia had fewer treatment options besides staying in hospitals for long periods of time. But when first-generation antipsychotics came out, these people could instead go home with a prescription. So how do these drugs work? They reduce positive and disorganized symptoms of schizophrenia, but have little or no effect on the negative symptoms. There is much more research needed in schizophrenia because current medication is lacking. Commonly reported side effects include sedation, dizziness, blurred vision, restlessness, and sexual dysfunction, as well as extrapyramidal side effects, which resemble Parkinson's disease, a neurological disorder. While a second wave of drugs came out, they were not more effective, nor did they produce fewer unpleasant side effects. In addition, the second-generation drugs cause weight gain, increased cholesterol, as well as blood sugar levels, which would lead to diabetes. Some psychological treatments that have been relatively successful include social skills training, which trains people to have new social behavior to reduce relapse, family therapy, which trains family members to be more affirming, cognitive behavioral therapy, which encourages these individuals to test out their delusional beliefs through discussions, and cognitive remediation therapy, which improves basic cognitive and perceptual processes. Other treatments also include psychoeducation, case management, and residential treatment.
When it comes to longer-term care, psychoeducation is a good place to start. Psychoeducation informs patients and their families about the symptoms of a mental disorder, the expected time course of symptoms, the biological and psychological triggers for symptoms, and available and recommended treatment strategies. This process is not unlike what we've done today, but it is much more detailed so that the patient and the patient's family know all the facts and have all their questions answered. So, what's next? We know the symptoms and available treatments. What does life look like next for a patient diagnosed with schizophrenia? Well, there are many options. The National Institute of Mental Health wanted to have an easy way for patients with mental health issues to access the services available to them. Case managers were created to aid patients with this, as they are trained mental health professionals who are familiar with the system and are therefore able to help patients with schizophrenia get into contact with providers of whatever services they require. Case managers make a multidisciplinary effort to help in numerous ways, including providing services to the community such as medication, treatment for substance abuse, helping schizophrenia patients deal with common stressors such as money management, conducting psychotherapy, vocational training, and assistance finding housing and employment opportunities. Case managers are a great way to help a family member with schizophrenia sustainably function outside the care of an institution, giving them elevated independence and peace of mind. For more information and further resources, check out the links at the end of this video. Thank you for watching. We hope you've learned something and feel more empowered to aid clinical patients and family members toward a sustainable future.